the stream finished?
Yeah, ma'am.
The webinar is being live streamed. Check.
Yes, now it's live.
Yeah. Now it's live.
Again.
Now it's live. Yeah. So we can start.
Okay, ma'am. Thank you. A very good evening and a warm welcome to one and all who have joined. Clarinet is proud to come up with another exciting webinar, The Experts in Conversation with Dr. Ritu Santwani. Today we have Dr. Mustafa Zakaria sir today with us as an expert who will talk on how does low testosterone affect male infertility. So let's take this opportunity to welcome Dr. Zakaria, our keynote speaker today. Sir is specialist in reproductive medicine and assisted conception. He is one of the founders of NSERM, which is MOROCCAN Association of Endometriosis and Reproductive Medicine. Welcome to this session, sir. Next, I would like to take this opportunity to welcome today's organizer, Dr. Ritu S. Santwani ma'am. She is consultant obstetrician and gynecologist, cosmetologist, and IVF specialist, director at Pune Test Tube Baby Center and Shyam Well Women Clinic. So, ma'am, now the mic is to you for your talk and next proceedings. Over to you.
Yeah. Thank you, Clarinet. So, a very good evening to everyone. A very warm welcome to my very dear friend, Dr. Mustafa Zakaria, all the way from the Morocco. A very warm welcome, doctor. And thank you for accepting the invitation. Before we switch on to the session, a very warm welcome to all of my friends who have joined all across the geography. I am able to see some of my friends have joined from Cairo, some from Saudi also, and some from the Pakistan also, and of course from my India also. So a very warm welcome to all of you, dear friends. So as all of you are aware, this series, The Experts in Conversation with Dr. Ritu, in this on every Thursday, Indian time, 8 p.m., we are here with one of the international speaker. This is a knowledge sharing global forum. So every week we are coming with some different topic where the experts will give their expert opinion, and later on we can have some question answer session. So thank you to all of you also, those who have taken the interest and taken out their time. So today's topic is very nice. That's how this low testosterone affects male infertility. And here with us, my dear friend, Dr. Mustafa Zakaria is here. So the voice is echoing. So as Devolina has also given the introduction, especially I want to add one more point. Dr. Mustafa is one of the founder of the Moroccan Association of Endometriosis and Reproductive Medicine. So I have done some webinars already with Dr. Mustafa. All had gone very well. So a very warm welcome, Dr. Mustafa. In our Indian language, we say Namaste, welcome. So dais is all yours, Dr. Mustafa.
Thank you so much for this invitation, Dr. Aroda from India. You are very welcome for this webinar. So today I will talking with about how does low testosterone affect in man infertility. This your very interesting, very topic for the big problem with man for world. So you can hear for in South Africa, in North African, with very important this title, because why you can you talking this about how does the low testosterone in world. Okay, now you continue for this presentation. Thank you again for Dr. Rodar. This is very accepting with me, was in a collaboration for a scientific program with this wonderful of this webinar. Thank you so much. Now you can again for continue.
Welcome. So you can share your presentation.
Okay, now.
Yeah.
See you.
Yes, only you have to take it on the slide share mode.
Yeah, you see my slide?
Yes, we are able to see. Yeah, we are
Okay,
able to
thank
see
you.
the slide.
I am Dr. Mustafa Zakaria, reproductive biology, extensive director of MOROCCAN, Society for Endometriosis in Reproductive Medicine. First of all, this you have one question is very important about what is low testosterone in MAR hyperamidians. Low testosterone is a connection is with in testes to man in reproductive goal. To do not with each testosterone. In man sex hormone for sex hormone, in testosterone help to intimation of the love and sexual connection. So in man testosterone help for sex in very important and sexual for engagement in muscle mass acquired for liver of our blood cells in sense of will beginning and sexual for reproductive function. Production of testosterone. Testosterone, one infertility and production of testo in a salmon for automatic in a graduate. So what? Testosterone, you interested for development of man infertility and secretary of reproductive in adjoints. And why so? What if a meaning of this question? You can read for in months of the meaning of strong directed applies for a man in women. Testosterone is very likely to change seen to body for the lightest. Low testosterone avoided depressions, low sex to diving to wife on low cementing. In hypogamesia, to dimension of affection in absolutely off guide. So for example, for diabetes in high blood position, have also to be like for so with low for testosterone level. So to measure of is very low within effort for age. Maximum, for example, in 20 and 30 and 40 and 15. So you can show a given for result of low in testosterone. This is especially for man. Too much testosterone. You can reading for in women. It's very big problem. In man, you can correlate for infertility to both man and woman. Chocolates on testo. Force in girls deficient with electric and protein. Increase risk of heart disease. Be careful in spite of low testosterone. In automation of heart education of linked with levels of testosterone. Where does testosterone coming from? So this is very good question. Why? In androgen of office in 50.50, defines into comment. And after to be season in testosterone by 50% in positive 5. Ovarium in apheresis 2-3 to have low 6 dropping. And after position to hormone to very low in etetic in testosterone, so I have him. For T cells to work in however to indicator with women, you have to be selecting this product. So test level for female 100 minus 400 microliter for in pi day in pi 3 time in electron. Testosterone in Alesia. So Alesia is not significant. It's in models, it's live for massing, it's in systemic visuals. Blood liver is not quickly of testis level because you can your connection is about behavior of diagnosis of testosterone. You have where we describe at free androgens for FLS to buy 400. It's very important. Semen. So to be casting for test in sperm, this no quick control for POL minus 7% in over age to 14 years. The androgens 0.5 milliproteins for a month and 3 months. Okay. The bucket level in 20 and half by age 14 was in 60-50 in free testosterone 30 minus 38 pound of remains. This one in 2018. Okay, testosterone is glucagon with both of use in women. So, however, we can say to recommend them of very high of testosterone in with female. This is very wrong. It's very big problem. So you can control of this hormone in women. So you can take off data of health for in reproductive medicine. You can control for this question as you physication of female. So limited data for MI in that short time with long with years. So in present together. For Anna, and testosterone is very dangerous. Okay. Hypotension and sexual for this topic. Female with this change position to stimulation for use testosterone range one and woman. Another for rising FOD. This recommendation in pass with our has surface in communication of concentration. Please with FSH and those low with LH. How to get them was up result in laboratory. So you can again be careful with check her for health. This women, you can also check your price in for low testosterone women. So you pass to kill in surgery for testosterone. Python ovarium is pregnant. Really for injecting for infection in modern devices to deplace word and name about testosterone for latest women. Say it again. Testosterone. Rate of testosterone and not licensed in concentration and however sex driver in users. In months in month, we calculation to help for ages in slide affected for breast cancer. This is bragging of in 3 months ago to tell me for have you give me for report in testosterone level. 3 to 6 weeks forever and after 6 months. Effect of testosterone, education for increase high gross waist, increment, hypoglycemia, acumen, glycemic. So, in education, corrective prevention, breast cancer, another hormone for the happiness cancer, activity liver disease, hypervigilance for free androgen index, this corresponds for risks of testosterone. Testosterone effect with low levels. This is very important because why? The diminution of power and others, defection, infertility, loss to body in fine hairs. The hypergramman in describe our words describing with contact low sperm in FSH and LH with absolutely was normal with testosterone instinct mentioned was in control. It's about low testosterone right. Last this question from Canada. Dr. Prime Holmes, what does testosterone do? This is very, very, very good question. Why is this protein that's very low control of sperm, defection in sexual to go west, exclusion, mentivicic, hypogor in protein, etc. So, the maximum of Christ, this in man, reproductive active, to be quickly, and center with growth of price of protein. Why can you testosterone level drop? The drop of testiculate, genetic disease, in concentration climate trend, break in quantum for biopsy, treatment of testiculate cancer, deficiency of premise in hypoglycemia. Why can you testosterone level drop? So, mantobosit, ovarian, diminution of addiction, in andromescent, in hypoproctonemia, productive of clients. So this all sum to 7 of cold liver testosterone to depth upper. The system in license of low testosterone man, you can be erection of problem, breast in education, and magnesium of change, lost months for a in decrease alike. Why this move in accumulation of low infertility? This is some like this problem with in low testosterone. Another problem in ovarian for low testosterone. It's a change for breast of kissing, low sexual interest. The sum for estimation at a class of number of low testosterone. This for publish of these articles. You can for result in DNA fragmentation in sperm connected for increase with this increase with level of testosterone. You can now see for TTE is very high. For to between DFE is very low. Some which you can use this increased level of testosterone. Testosterone we have total of 44 with albumin prime in 6 hormone globin 15%, and testosterone free is only 2%. Glyba 4 in 2004. This result. Which indicator who is low testosterone for insulin resistant? Another for cells in T cells for protection, and another for decrease. Increase for insulin resistant. Wise for it's very important for remixing low testosterone. You can use this video for a program in the doctors in UK in contact with the American Association for Reproductive Medicine in this program. You should.
Dr. Mustafa, sorry to interrupt you, but there is no sound on the video.
Okay.
Yeah. Still no sound.
Yeah. Conclusion. First, to stop for smoking. For man who is smoking, have to low for liver expression in hormone indicator for testosterone. Loss in weight, in overweight, man you can have to indication for testosterone level. In contamination for emission diet, to take care with more to help for improve testosterone level. So lifestyles will change with your life in man and for women to take care this your in balance of testosterone level. And thank you for your attention. And again, you are welcome for enjoy this Congress of Masarm. You can all them for attend this Congress of Manuel for War in Association about MOROCCAN. You all them, you welcome. Thank you so much.
Thank you so much, Dr. Mustafa, for such a crisp presentation. So thank you once again. So friends, if any questions are there, you can please post here. So meanwhile, I have received some questions. So yeah, the first question is from this. I received some in my YouTube and some in the WhatsApp. The first question is by Dr. Tommaso Falcon from UK. He's writing, the low testosterone levels are fully explained by low levels of serum human binding, sex hormone binding globulin found in men with insulin resistance. What's your opinion in that?
Yes, this is a good question.
Yeah.
Insulin resistant in sex hormone bleeding drama. So liver testosterone leads production of obese man. We have indication effect in severe clinical in automation. This an analysis man's testosterone liver wants to 150% of obese of man. This for low testosterone liver.
Yeah, thank you. Another question is from Dr. Horace Roman. He has joined all the way from the France. He has put the two questions, Dr. Mustafa. First is that, what about the incidence? How common is the low testosterone?
Okay. Low testosterone affect a month 14% in men. Age for 40-15% in old. It is difficult. Define a normal testosterone low. Why? Because liver is very intrusive for one day. Some for body mass and disk in alcohol in a combination force. Some is take care about low testosterone affect months for between us in 14% to 45% of age. This was man.
Yeah, very true. Dr. Horace has again asked another question. What causes the low testosterone?
It's a good question. As a man for age, a mutant for testosterone has a body. Look, the doctors, why you have 5 and 6 of cases about low testosterone. Enjoy tram for blood solution of testes, infection of testes, ischemia glycemia of cancer, metabolic decrease which of low in testosterone in hormone and defection of tremors of in some to less of test of testosterone low. Correlation of kidney infection in kidney disease. So number 6 in HIV. So you can use for in cases of low testosterone.
Yeah.
This is very important for all cases of testosterone.
Yeah. Thank you. Thank you so much, Dr. Mustafa.
You're welcome. You're welcome.
Another question I have received from Dr. Poonam, I will take your question also, but some I have received online. First I'm winding up that questions. Another question is from Dr. Nicholas Leland. He is joined all the way from Canada. As you have answered, he is actually having the same questions. Almost the same question. That how is he's having one more question. Yeah, how is low testosterone diagnosed?
Oh, nice. Good question. Diagnosis of low testosterone and a mountain of testosterone is the blood of test. This is why blood is very important. It's necessary. You can use test for blood. In severe malformation of details of data in how is control for testosterone. Testosterone for serum is signal for liver of to change throughout one day.
Yeah. Thank you.
Okay.
Thank you so much, Doctor.
Thank you.
Yeah. One more question from Dr. Nicholas from Canada only. He is writing, what are the symptoms of low testosterone level?
Symptoms of low testosterone depended with age imposed for indicator the following: low sex delivery in definition of continuation of low testosterone. So it must for low must in a system of the test with the body of low testosterone. So this question and some following about the of concentration about low testosterone.
True.
So one.
Yeah. Thank you. Now, Dr. Edgardo Somigliana joined from all the way from Italy. Thank you, doctor, for joining. And he's having two questions. First question, can low testosterone levels can be prevented? Are there any preventive measures?
There are no was preventing for low testosterone. They are connection for genetic connected for damage of testo or in parallel gurnament. For now, you can for predicts of low testosterone. This for explain within videos Canada's Dr. Simon line. You can testosterone with low of spare in serum of blood. This is very big control on choose with the following about low testosterone.
Yeah. Thank you so much. Other question, I think he has missed some presentation because you have already shown in the slide. The other question he has mentioned, what does testosterone do? So that you have clearly shown all in your presentation.
Yeah.
So thank you so much. And one more question here in the chat box, you can see that is from our dear friend Dr. Poonam Gupta, who is joined from Varanasi. Poonam is writing, do you advise testosterone tablets in the treatment of infertility in your practice? You can see in the chat box, doctor. The questions are there in the chat box. Yeah.
Is this question for me?
Yeah, yeah.
Okay. And this question, good question. First, you for explain about in low testosterone for man infertility, because you have some cases in with your life. You can some problem is in your hormone in enzyme. You see for in test in control with doctor with go to for to check about your body and how is good for in hormones in about of testosterone, because another for infertility this is very interesting for a man, because you check about hormone testosterone, you for low in can you high in can you normal, this is very important of result.
Yeah, thank you so much.
You're welcome.
Yeah. Yeah, Poonam, we are to not using this testosterone tablet. Yes, I am agree to Dr. Manisha. Yes, DHE has got some studies for the improving for this low testosterone levels. So I think we have finished with this, all the academic questions. If there are any more academic questions, friends, you can write here. Meanwhile, some are writing for regarding my YouTube channel. So I've already posted the link. The program has gone live on my YouTube. Another, those who want to become a part of the academic group, I already shared my WhatsApp number. Please drop me the direct inbox message with your name and workplace. So I will happy to add you all in the academic group. More questions are coming. Let me see. Yeah. Same dose, Dr. Poonam, 25 mg is usually the studies have come, Poonam, for 25 mg OD. But if the patient is overweight, obese, in some patients, I will share some papers. So up to 3 months. 3 months, Dr. Poonam, the studies have shown up to 3 months. 3 months, and some papers have come for studies up to this 2 months also. I will post, give me 2-3 days, I will post in the academic group the papers. So Dr. Mustafa, as this show's name is the experts in conversation with Dr. Ritu. So now we have finished the academic questions. Now some non-academic questions. So,
okay, no problem. No problem. Yeah,
so this will be the rapid fire round, and you have to answer in one line without thinking much. So
no problem. No problem. Thank you so much for this investigation in this webinar. So you for update you for about information in this low testosterone. This is very important with men and women on future for this year. Can you work in a clinic, in hospital, in center, in academic? So this in very in account of information to update for 2021, and you are welcome to webinar in Congress to 2022. Thank you so much for this investigation in webinar, and you are welcome. Thank you so much, Dr. Rauda.
Most welcome. Dr. Mustafa, you want to give any message to the upcoming gynecologists? Any message you want to give?
For what? Any message? Okay. Okay, no problem.
You are doing, Dr. Mustafa, you are doing such a nice work. So any tips and tricks you want to give to the young doctors who are coming, that how they are seeing you as a role model? So any message you want to give them, how they can do so work hard and do more and more work? Any message from your side?
Yeah, no problem. First of all, number one of message, friend, And thank you very much for Dr. Rauda in this in conception for number of association of RFF at Serge in association of MOROCCAN Society for Endometriosis in reproductive medicine. And so thank you for all them for about webinar for you in for Congress. Some you can wonderful and excellent for information about you for in about this Congress accent for excellent really for enjoy to coming with the number of Mr. Thank you so much. And another message you can all them for enjoy to research in scientific for new articles for new education in fertility. Some you like for to contact with international with MOROCCAN in Indian. So thank you so much. Really, I have one message is big interest. You can enjoy for update for information in infertility in for enjoy to writing of articles for fertility and infertility. So you are welcome, Dr. Rauda, for thank you so much for anything, for any information, for any enjoy for number of this association. Thank you so much.
Thank you, Dr. Mustafa. A very crystal clear message. Yes, friends, all of you agree. Our field is like that we have to always upgrade our knowledge and share the knowledge. Knowledge always increases by sharing. This is my funda. Why I made this all academic groups, why I initiated this series, Knowledge Sharing Global Forum. What the problems I faced when I passed out my examination, there was no one to guide us. So now the social media is so strong. So we can share our thoughts, we can share our knowledge. And I think this is the best platform where we can interact what the problems we are getting in our day-to-day practice. So thank you once again, Dr. Mustafa, and thank you to my all of dear friends who have joined all across the geography. Thank you so much for joining, for your interest and time. So, yeah. And thank you
so much.
Yeah. And thank you once again to the Clarinet for always, whenever I ask the Clarinet for the platform, I am very much thankful to, special thanks to Preeti, Pragya and Debolina. They are always ready to provide the support. So friends, see you on next Thursday, same 8 p.m. Indian Standard Time. We are having Dr. Nasreen Zeenat Sheikh all the way from the Bangladesh and going to discuss a very, very important topic, the cardiovascular symptoms, how to manage at the time of the menopause. What are the practical tips for that? So friends, so stay tuned with me. Now, a lot of interesting programs are coming up. So bye-bye.
Okay, thank you. Bye-bye.
Bye-bye. Yeah.
Bye-bye.
Thank you all. Good night.
Yeah, good night.